Good morning to all of you, and a warm thanks to participants and my friends. As narrated by the anchor, that it's a story of empowerment of people with disability in India. I think 10% of our population is with people with disability, around 10 crores. So you can think of how big is this problem. And so you can say Sarthak through in last efforts of Sarthak in last 13 years has empowered them by giving them livelihood. So I think it start with my story. Of course, I was born in a family in Haryana, and after going to boarding school and then getting dentistry from Davangere, I think I was practicing dentist. I used to practice in Delhi, and you can say after in I think I got married in 2000. I think my wife is also dentist. Was blessed with a boy in 2001, so everything was perfectly all right, and it's like a Indian family. We were there in Delhi. So in 2004, I think it was like turn around. जैसे आप सोचते हैं वैसा नहीं होता जीवन में, but ईश्वर का एक अपना डिजाइन होता है जिससे आपको जीवन जीना पड़ता है. So in 2004, when I was working on a patient, I was not to see. It was like blurred vision. I was not able to perform on the patient. Maybe I thought it might be due to stress. I'm not able to see, but after 3 4 days, it got continued, and then I realized that it's a some eye disorder. I think we went to ophthalmologist, and then I was diagnosed with heredomacular degeneration. So heredomacular degeneration is an eye disorder, and globally there is no cure. Generally, doctor says because of hereditary reasons you have this problem, but with God grace, no one was there in my family. And so what happens in heredomacular degeneration? You are not able to read and write. So you can think, if you are not able to read and write, you are not able to do your dentistry. Your profession is gone, and you can say you are there in drooping in the darkness. आपके लिए जीवन जीने के लिए बहुत मुश्किल है. It's like frustrating, irritating, and I think all the doors are open. And so during, I think, 2004 to 7, that time period was really challenging. And you can say, you can see the behavior of you can say of people around you, the patients who are there, society, community. So it's like a story of a disabled person in India, कि हमारे देश में कैसे एक दिव्यांग जन को देखा जाता है. अगर वो देख नहीं सकता, he is hearing impaired or physically disabled. So generally people see people with disability कि I think इनको कोई मदद की जरूरत है, इनको कोई support की जरूरत है. And that was the same story of myself. And during that 2004 to 7 journey, it was really challenging. You can say I was exploring myself, my livelihood. We were exploring. So I think my friend Dr. Jain was there, who was with me. Every day I used to discuss with him, and we were exploring livelihood thing for myself. I think for in academic section, to teach you can say dentistry students in dental college, medical goods, but things were not perfectly all right. We were exploring different things. And one day, my friend Dr. Jain, I think, were told by someone that people who are blind or people with low vision can work on computers. And I think next day, immediately we visited that organization. The manager of the organization told that you can work on computers. You can learn, if you want, you can learn computers. And I think that was little ray of hope for us. I learned computers, and after that, I think with suggestion of few of our friends, then I learned medical transcription also. So it was like 2007. I was trained on medical transcription, but I think it was last month of December in 2007 that there was no work coming from the US, and it was like 15 days for me to go out of my, you can say, boundary wall and research on this subject, that what is happening for people with disability in India, organizations working for people with disability, and what is the need of the hour for them. And I think that 15 days of my research that gave birth to Sarthak, because I was able to see that people with disability were trained, people with disability were having education, they were having you can say assistive devices, but I think nobody was thinking about their employability, especially in private sector. And even private sector was not aware how to hire and where to hire what disability. Generally they used to ask that how they will come, what they will eat. And I think as a professional I thought to work for this cause, social cause, because I was not trained to run a social organization, but with God grace we founded Sarthak in 2008. So initially, because you have to prove the concept to the community, to the society. So I converted my clinic into a training center. And before starting this program called Medical Transcription for Visually Impaired, we contacted a group of companies that were there in NCR for medical transcription. And I think four of the CEO were interested in training and hiring people with disability. And we requested them to be part of selection process, then training and hiring. So they were there. And I think Mr. Subhor Khanna, I still remember, was kind enough to visit our place. He shortlisted 8 people with disability. He was there in the training program, and I think most of the people were hired by him. So it was a like a proof of concept now, successful concept. People were believing now that people with disability are employable in private sector. We were, I think, professors from MDI visited us. I think we were introduced to a corporate house in heart of the city in Delhi. We shifted to that place, and there was a boom in the market now that people with disability are employable in private sector. So I think more responsibility on us. We started, uh, we worked on two principles from 2008 to 13, because during that time, there was two things required. One was demand creation in the market, and demand creation in the market for with BPO houses, with retail, hospitality, and manufacturing sector. And second concept we worked was a supply chain, like databases of people with disability, or working on the supply chain of people with disability. So initially, because all disabilities started coming, people coming to us for jobs, people with hearing impairment, people with physical disability, intellectual disability. So initially, we targeted two BPOs, AGs and NetAmbit. They hired people with disability, and they spoke in front of around 50 BPOs. I think through cross learning, through stakeholder workshop, I think we were able to convert more BPOs. Similarly, we have roundtable conference for hospitality. We have stakeholder roundtable conference for retail, and like that, conversion started for hiring of people with disability. So just working on database of people with disability, because there was no structured database. Government is not having databases. NGOs working for people with disability. So what we did for making that supply chain of people with disability, we traveled from Srinagar to Chennai and from Ahmedabad to Guwahati. Around 100 job fairs we were conducted, where employers, and there was a one-to-one interaction between the employers and the people with disability. And by 2013, and I think around 60,000 youth with disability got registered, and 3,000 got the job. And then the question came that what about 57,000? And our team was able to diagnose the challenge that people with disability, current skill set of people with disability is not matching with the current market requirement. And we have to plan structured training program for them. And where that in 2014, we started structured training program for people with disability, with all disability, in BPO, retail, hospitality, job roles. And it was with the structured NSTC curriculum content. We started 2014. So in 2014, it was, you can say, transition from of Sarthak to serve people with disability, you can say, across life cycle of people with disability. So started from health vertical to education, skill, employment, advocacy, and Olympics. So in health, we were able to do, you can say, preventive programs, early identification, and early you can say intervention program. We were able to cure most of the disabilities. We were there in education space where we created resource centers in government schools where people with disability were, you can say, not included, were included by creating resource center. Skill program from 2014 to till date. Now we operate in 15 states, 21 centers we run. Employers who are there, 1,000, like not a single employer in 2008. Now we have around 2,000 employers who are hiring people with disability all across sector like Amazon, Flipkart, or Walmart, or IBM or Genpact. Everybody is hiring, and hiring in numbers as a business model, not as a charity. And Abilympics is a part of Sarthak, where the movement started in 1983 in Japan. So these are skill competitions for people with disability, national, international. So we are conducting these events, and next, you can say participants are traveling to Russia in 2021. So you can say 13 year of our journey, we are able to, you can say, empower around 21,000 people with disability. But this is just start of journey, because I think it's a model which is accepted and people are replicating it, and we are hoping that we will be able to empower each Divyang in India in coming years. And that's why we are partnering with the smaller organizations that are there in the rural part of India, and we are working aggressively. That's why we have created a platform called NDEA, National Disability Empowerment Alliance, where 250 NGOs all across India are part of this, and we are aggressively working on their capacity building. Coming to, you can say, transformation of Sarthak during COVID, because COVID was really challenging for us and challenging for all of us. But I think 21st March, when we went we were going for a lockdown, we were not aware what to do, but in a week time, we were live, and all our programs like online therapy program, education program, skilling program, employment program, we are online now. And I think in last 1 year, around 3,000 people with disability got jobs also in work from home program. And what COVID has done, it's like, of course, COVID was adversity for us, but it's opportunity for us now, because what we realize that online training program is win-win for people with disability, because they need not to come from their residence or houses, so that to face inaccessible environment, inaccessible infrastructure, transport system, and it can be a solution for in coming years for people with disability. Digital transformation, we are coming up with e-learning management solution, first of its kind in world, and we are hoping that things will be online for people with disability. Coming to our Vision 2025, we targeted around to train and place around 1 lakh people with disability by 25. That's why we are scaling up our program, creating more awareness, working for the talent pool for people to train people with disability, because it's of course a challenging task, but we are working aggressively on that part. So coming to, you can say, last part of my talk, I think I want to give some message to people with disability. दिव्यांग जनों को कुछ संदेश देना चाहता हूं कि जो सार्थक का प्रयास है वो हर दिव्यांग के लिए, सार्थक का प्रयास हर दिव्यांग के विकास के लिए है, और आने वाले वर्षों में वो होगा। मैं दिव्यांग जनों से यही बोलना चाहूंगा कि उनकी आइडेंटिटी डिसेबिलिटी नहीं है, उनकी आइडेंटिटी उनका स्किल सेट है, उनका परफॉर्मेंस है। उनको डिसेबिलिटी सिर्फ हमारे दिमाग की होती है, डिसेबिलिटीज ऑफ आवर माइंड ओनली, बट अगर हम सोच ले, ठान ले, तो कुछ भी कर सकते हैं। और हमारे देश में like we have examples like people with disability are bureaucrats now, they are IPS officers, they are all across the board now, but हमें हर दिव्यांग को यही सोचना है कि हम सब कुछ कर सकते हैं। And especially my request to the parents now that आपको उनको खुला छोड़ना है, उनको सपने लेने देना है, because वो सपने लेंगे तो सपने अवश्य पूरे होंगे, और आपको उनको सिर्फ उनको सार्थक जैसे प्रोग्राम्स में अपने प्रदेश में जोड़ना है, उनके साथ उनको अलाइन करना है। एंड माय मैसेज टू, यू कैन से, नॉन डिसेबल्ड ऑडियंस, कि मैंने जो जीवन में सीखा है, इम्पॉसिबल कुछ नहीं होता। अगर हम लोग वी थिंक अबाउट इम्पॉसिबल, सो इट्स लाइक आई एम पॉसिबल। हम कुछ ठान ले तो कुछ भी कर सकते हैं। हम सब लोग अपना जीवन, लाइक वी स्टार्ट विद एजुकेशन, देन वी वी आर गोइंग फॉर एम्प्लॉयमेंट, हम कर्मचारी बनते हैं, बट आई थिंक रियल ट्रांसफॉर्मेशन कम्स व्हेन वी बिकम फ्रॉम कर्मचारी टू कर्म योगी। सो हमें अपने जीवन में यही सोचना है कि अपने लिए करने के बाद कुछ दूसरे के लिए भी करना है। सो दैट कैन गिव यू, जैसे आपको एम्प्लॉयमेंट मिलने के बाद जॉब सेटिस्फेक्शन होता है, तो then that can give you life satisfaction. So think about that life satisfaction, all the audience, all my colleagues, friends, बड़ा अच्छा लगेगा, because रात को अच्छी नींद आएगी और अगले दिन कुछ अच्छा करने का मन करेगा। I think in the end I like